All right, good morning. It's so wonderful to see such a great crowd here this morning. As you heard in the introduction, I've kind of been all over the place, but I grew up in New Orleans, so I'm glad to be settled down close to home now here in Baton Rouge. So my talk is on healthy skin at every age, and I'd also like to say for every skin tone. So number one, most important thing, protect from the sun, UV ultraviolet damage. What ultraviolet radiation does to your skin is it damages the genetic material of the cells, which is DNA, and that leads to mutations and that accumulate over time and ultimately result in skin cancer. So what you see visibly is redness and inflammation of your skin. I mean, that's what a sunburn looks like. We all know what that looks like. And it also causes the visible signs of aging. So I feel like, you know, it's easy to say those words, but what do you really see? Like when you see someone and you know that they look maybe a little bit older, what you notice are the wrinkles, kind of yellowing of the skin, discoloration, whether it's light spots and dark spots. There's a lot of redness and those open pores and deep wrinkles. UV also generates free radicals, which I'll talk more about in a minute. So I think it's reasonable to be skeptical and say, well, the sun is a beautiful thing. Everybody loves the sun. Everybody loves being in the sun. Does it really cause something bad like cancer? So I'm going to give you some statistics and then you decide for yourself. What we do see is that there's higher melanoma rates near the equator and in high altitudes where the sun rays are much more intense. We see that if you can kind of quantify how much photo damage somebody has by looking at their skin coloration and atrophy and wrinkling and all those things, the more photo damage that you can identify on their skin, the higher that person's risk of skin cancer is. So those two things go hand in hand. Having more than 5 sunburns in your life can double your risk of melanoma, and I think there's few in this room who've maybe never had a sunburn, so we're all kind of, oh, that applies to me. Using tanning beds before the age of 35 is associated with a 75% increased risk of melanoma, so that is a B. And you say, well, you know, maybe I've been to the tanning bed once, but I mean, I'm not a tanning bed person. I'm not addicted. That's not really my thing. Going just one time, once ever, all by itself increases your risk of melanoma. And now, it's not just melanoma that you're putting yourself at risk for with UV damage and with tanning beds specifically. You're also at increased risk of squamous cell carcinoma by up to 67% and basal cell carcinoma. And those are lots of fancy words that I'll show you pictures of what that looks like a little bit later. But just know that the UV exposure you get from the tanning bed increases your risk all around. So I really regret that this last line I didn't put in bold red letters with flashing animation, because I think that this is an impressive statistic. There was a study that came out year before last that determined that worldwide the number of skin cancers that are attributed to UV tanning beds is higher than the number of lung cancers that is due to smoking. So the tanning beds are highly recognized as carcinogenic, and so I think it's a big deal. Now my husband, who's a lung doctor, was watching each night as I was preparing this talk and looking over my shoulder, and he kind of furrowed his brow and said, well, you know, because he thinks lung cancer is more important than skin cancer, obviously, which may be true in the sense that certainly lung cancer is more likely to kill you than a skin cancer is, but in terms of raw numbers, UV and tanning beds cause a lot of damage. Where do you get all this ultraviolet radiation? So we've already blamed the sun, but you're not off the hook on a cloudy day. So, and anyone who's gotten a sunburn on a cloudy day knows that you are still getting UV damage through the clouds. The clouds only filter about 20% of the sun's rays, so you're still getting a lot. You're not safe just because you can't see the sun out. So you still need sun protection. You still need to seek shade. Tanning beds, the big bad wolf. I've already talked about how much damage that they cause, not just in the United States, but on a worldwide level. It's a scary thing for us as dermatologists, and there's a lot of legislation that's kind of being pushed, and so you can argue the politics of whether that's the right thing or the wrong thing, but unfortunately, a lot of the tanning industry focuses on younger people, teenagers, young adults, And so I think it's important for all of us as women not just to worry about ourselves, but worry about those younger women in our life that we care about, whether it's our daughters, our nieces, our neighbors, and really kind of encourage them or discourage them from going to the tanning beds, and encourage them to love their skin, and not that they need a tan to look beautiful. So I can put all kinds of statistics on there, and it's just a bunch of words on the page, but until you see it, I think that this really brings it to life. A picture's worth 1,000 words, as they say. And so this person is a truck driver who spent 30 years of his life driving. And so, you know, you're looking at them, so flip yourself. So this is the left side of his face. That's the driving side. And this person did nothing, but you can see that just the damage from the sun in this split face is very impressive. So what does UV protection look like? So sunscreen, of course, is kind of everybody's go-to. It's easy to use, it's easy to find. I think it should be part of your daily routine. So everybody always asks me, well, what sunscreen is best? And I don't know that there's one sunscreen that solves every problem, but there are certainly some that are better than others. The number one most important thing, in my opinion, about sunscreen is that you find one that you like and that's easy to use. Because, I mean, I can tell you, go get this $100 sunscreen, it's the best, but if it's not user-friendly and you're not going to use it, then it's not going to do you any good. So I will say, in general, higher SPF is better. And that's a little complicated because the way that they measure the sun protective factor to get this number is in kind of standardized settings. And what they do is they put it on really thick, so a shot glass full to cover the whole body. And most people don't really put it on that thick in daily practice. So if you're not putting it on as thick as what they did in the study to determine the SPF factor, you're not getting that maximum protection. So you may be perfect. I'm definitely not perfect. So I like higher SPF so that if I'm not perfect putting it on, I still get more benefit than not. There are two main categories of sunscreen. There's the physical blockers and the chemical blockers. The physical blockers, that's zinc oxide and titanium dioxide. That's what's listed on the active ingredients. Those provide more broad spectrum coverage, so they're better. They sometimes leave a little bit of a white residue on the skin, so they're not quite as user-friendly. They're not quite as easy to use. There are some fancy formulations that have tinting in them that make them not as apparent on the skin. The chemical blockers are a little bit easier. All right, so I have small children. This is my older daughter, and chasing after her to try to put sunscreen on it's a losing battle. It's a lost cause. So I am a big fan of hats, clothes that have sun protection built into the fabric, so I can feel safe that they're protected even when I can't quite reach after them because they're running away from me to get moisturizer and sunscreen on. So I was really proud of myself when we went to the beach last summer as a family, and nobody got a sunburn. That was a win for Mom right there. I'll probably get a B- as a parent because her little legs are exposed, but I mean, nobody can rock sun protection like that. I think she looks too cute. All right, step number 2 for healthy skin is antioxidants. So this is an exciting thing in dermatology that's always talked about at every dermatology conference because I think this is really the cutting edge stuff. So not only does UV rays directly damage DNA, but it also generates free radicals, which are these high energy particles that basically just bounce around and wreak havoc within the cells. So it further damages DNA, it damages collagen, which is the molecules in the skin that give it that plump and youthful appearance. Not only does it damage collagen, but the free radicals inhibit your body's ability to repair that damage. So it's really a double whammy. As we accumulate birthdays, that oxidative damage accumulates as well, and also our body's ability to repair that damage decreases. So it creates this vicious snowball effect. Oxidative stress and damage has been associated with loss of the skin elasticity and increased wrinkling, which again, you see visibly as photoaging. You get antioxidants both within the body and from external sources, so your body makes its own antioxidants, which is wonderful, and you get more antioxidants with healthy fruits and vegetables. It is really our body's main defense against the oxidative damage that you get from sun exposure. And if you look at it, people who are deficient in antioxidants they have damage to their DNA that looks just like the damage that you get from the sun. Your antioxidants that your body makes are depleted. You don't have as many after you've been exposed to the sun. So it makes a lot of sense that, well, why don't we just supplement with a bunch of antioxidants and we're just going to prevent that damage, and our skin's going to look great. And I will say that it's not quite that straightforward. There actually have been some studies that showed that oral antioxidant supplementation can be harmful, in the sense that a lot of those vitamins you can overdose on, especially the fat-soluble vitamins. So I would say maybe approach with some caution in terms of you're not going to get all of your sun protection in a pill, not quite that simple. I'm also not saying don't take antioxidant supplements, because people who are truly deficient in antioxidants may have their general overall health improved by supplementation. So it depends kind of on you. Now, dermatologists, we love that our organ, the skin, is not only the largest organ, but it's the one accessible from the outside. So why fool with a pill when you can apply something and get the benefit without any potential side effects? And so, as I said, this is cutting edge in dermatology. We get really excited about it because there has been shown to be some benefit of using topical antioxidants on the skin to try to prevent and limit, or maybe even in some ways reverse, some of the damage that you've gotten from UV radiation in the past. So using it before sun exposure is important, because if you've gotten the sun exposure and then you apply your antioxidant, the horse is out of the barn. It's a little bit too late. I will say that there are some limitations to using antioxidants topically, because the whole purpose of the antioxidant is to absorb high energy particles, so they get broken down very easily. They're unstable. So it's hard to kind of put that in a bottle, literally. The other thing about topical antioxidants is that the whole role of your skin is to keep the outside world out. So it's trying to protect your skin, or protect your body from outside things coming in. So it is a little bit hard to get the antioxidant through that top layer of the skin to the layer of the collagen where it really needs to do its main work. But I think it's a work in progress. So the number one antioxidant that I usually prescribe or recommend to patients, because I think there's the most science and there's the most background for it, is topical vitamin C. It's been shown to stimulate collagen production and improve the appearance of photo-aged skin. So that's a good one that's pretty easy to find, either in doctor's office or on Amazon. That I think that there's the most science to support the use of vitamin C. Resveratrol is a more cutting edge one that they always talk about at every conference I've ever been to, resveratrol. And so I think you'll see it more and more as another ingredient in a lot of products. There are some standalone products that I know you can buy on Amazon, and it has been shown to prevent the redness and thickening that happens with sun damage. Coenzyme Q10 and green tea, I don't think have quite hit the limelight yet. There's some promising data about how they can prevent photo aging, but I think they're a little bit harder to find. But stay tuned. I think that people will continue to work on incorporating those into a lot of skincare products. All right, so this slide brings me back some flashbacks of medical school, because in medical school you look at these pictures of molecules for 2 or 3 years and try to spend that time figuring out, well, how does that apply to my patient? What is this? And so this is a molecular structure of a retinoid, which all the dermatology nerds get really excited about, because retinoids are our favorite. So why do dermatologists love retinoids? And you're laughing, I think, because you probably asked your dermatologist what to do, and they're probably the first thing out of their mouth was a retinoid. They increase the rate of epidermal turnover, so they basically make the skin peel and give it fresh, kind of healthy new cells. It increases collagen production, which I've already talked about collagen, how that's the molecule that gives your skin structure and give it that plump, youthful, dewy appearance. I will say that there are some drawbacks to retinoids. They have not been proven safe during pregnancy, which I think is important to say in a room full of women. We know that the oral version of the retinoids can actually harm a baby if consumed during pregnancy. The topical version, I think, is a little bit more controversial, because I've already said that the whole purpose of your skin is to keep the outside world out. So how much of what you apply to the skin actually gets into your system, I think it is not that high, but I will say that they have not been proven safe during pregnancy. So if I have a patient using it that becomes pregnant, I usually just tell them to stop it. Now, dermatologists, I'm sure everybody thinks we're crazy because we love these retinoids so much because there's the most science behind their use. They're really the best things that you can do topically for anti-aging, but they come with a little bit of baggage. So they do cause redness, dryness, peeling. Some people even say they cause a burning sensation when you apply them to the skin. So that can make them a little bit less user-friendly, a little bit harder to use. But I like to tell people that before they start using it so that they don't they're not worried. Yes, ma'am. So she's asked if that's a temporary side effect. Your skin does get used to it over time. So it's a gradual process. You kind of build up a little bit of resistance, I think, to those side effects, but it can be a process to get there. All right, so which retinoid do you need to be using? That's certainly a personalized decision, but I kind of broke up the retinoid options into the over-the-counter, that's what I mean by OTC, and prescription, that's what I mean by RX versions. So you'll see retinol as the active ingredient in most of the anti-aging products and creams that are sold over the counter. And then adapalene, I think that this is fun, is adapalene is different and has been prescription for years and years. And I think it was last year, maybe year before last, that it went over the counter. So it's kind of cool that you can get a prescription strength retinoid over the counter now. It is sold in the acne aisle. It's marketed as an acne product. So you'll look really smart when you go there in the acne and you're getting your anti-aging product right there. Prescription-wise, there's a whole bunch of different versions that you should discuss with your dermatologist if that would be a good option for you. Okay, next, avoid smoking. So I already talked about, the difference between carcinogenic effects of UV tanning beds versus cigarettes and lung cancer. But why am I bringing up cigarettes again when it comes to your skin? Well, it turns out cigarettes are not only bad for your lungs, but they're bad for your skin too. So what they can do is cause premature aging of the skin. So the analogy is that maybe somebody who doesn't smoke accumulates the normal wear and tear on their skin from sun and life, and maybe this is what they look like at age 70. But a smoker will accumulate that damage much more quickly, and maybe at 40 will have just as much damage as this 70-year-old. Smoking delays the healing of wounds. Smoking increases your risk of infections of the skin, and it is associated with worsening of common skin diseases. So in my dermatologist's opinion, this is a beautiful picture of psoriasis. Maybe not so beautiful to everyone, but you can see the very typical red scaly plaques of psoriasis. And what we know is that people who smoke have worse psoriasis than people who don't smoke. Smoking makes acne worse. Smoking makes this problem called hidradenitis suppurativa, which I don't want you to remember that name, but it's an inflammatory problem that causes pimple-like lesions and boils under the arms and in the groin area and makes that problem worse. And smoking can actually decrease the effectiveness of many medicines that we use to treat skin disease. So again, a kind of a double whammy. Not only makes the disease worse, but makes your treatment less effective. It does cause yellowing of the teeth and nails, which is, I think, something that we've all probably noticed here and there on other people. And then here we go right into the lunch hour with the black hairy tongue. And then that's when you know that dermatology is maybe not as glamorous as the Botox that we think of, because this is the kind of thing that we look at all day, every day. I will say also with smoking is that it's associated with a greater risk of wart-associated cancers, which is kind of a scary thing. So what I mean by wart-associated cancers are human papillomavirus infections, so HPV infections that eventually over time lead to the development of cancer. So that's most cervical cancer, many cancers of the penis, also some cancers of the oropharynx and larynx. How does it do that on a molecular level? Y'all are like, I feel like I'm in med school today talking about all this science and oxidative stress, but smoking just kind of further causes oxidative stress that I've already talked about that happens from the sun, but happens from cigarettes as well. It decreases the oxygen tension, which causes the tissue to be ischemic. Ischemic tissue is not getting oxygen, it's gonna die. So, it kills those skin cells. It also further degrades that collagen that I've talked about as an important component to the youthful appearance of skin. So I feel like it's easier said than done, but if you can quit or even make steps towards quitting by cutting back, I think that you'll do yourself a lot of good, not just for your overall health, but also certainly for your skin. I think that it's really a lot easier said than done to say, oh, I'm just going to quit smoking. And if you've smoked or you have a loved one who smokes, you know what a big challenge that can be. So I would like for you to know that there are certainly resources available. There's a lot you can see online. Certainly talk with your doctor, encourage your loved one to talk with their doctor, because cutting back and quitting is definitely helpful. All right, so now as a dermatologist, this is maybe my favorite of all of my points, is monitoring the skin. So skin cancer is a big deal. I mean, this is why one of the huge reasons that I went into dermatology is because there's nothing that I love more than identifying and treating and curing skin cancer. So globally, skin cancer causes more cancers than all other cancers, or there's more skin cancer than all other cancers combined. So it's a huge deal. 1 in 5 Americans will develop skin cancer in their lifetime. 9,500 people are diagnosed with skin cancer each and every day. That's huge. And 3 million Americans will be affected this year. Now, we talk about the difference between this non-melanoma skin cancer and the melanoma type skin cancer. As you can see, there are not as many melanoma cases as non-melanoma cases, but we look at it in a different category because the melanomas can be more deadly. It's estimated that greater than 175,000 new cases of melanoma will be diagnosed in this year alone. And we really harp on this in dermatology and Mary Bird Perkins, because if you detect a skin cancer early, it's so much easier to treat. It usually just involves cutting out the cancer. Doesn't often require chemotherapy or other invasive imaging. And so we know that if we catch it early, it's a smaller surgery because there's less to cut out, and you're more likely to do well, less likely to die of that cancer. So risk factors for skin cancer are certainly UV exposure that I've already talked about in tanning beds. Stay away, bad, don't go. Having blonde or red hair and light eyes is definitely a risk factor. And my favorite dermatology teacher taught me that, you know, we think about light skin, that Irish skin tone, as being a risk factor, but maybe just your eye color is even more important as a risk factor than your skin color and your ability to tan. I think that's good to point out because it's easy to have a false sense of security if you're like, oh no, I don't, if you say I don't burn, I didn't really get that much sun. No, that's not really true. You're still at risk. You're still getting sun damage. Having more than 50 moles is certainly a risk factor all by itself. And you say, maybe I'm not a very moldy person, I don't have that many moles. Having just one abnormal mole puts you at risk for skin cancer. So abnormal moles are a little bit tricky to define, and they have all kinds of different names, which makes it more confusing. Some people will call them atypical moles. I call them dysplastic moles. Others may call them an abnormal mole. They're bad. They tell me that you are at risk for skin cancer. Having a personal history of skin cancer puts you at risk for having another skin cancer. And it doesn't necessarily mean that that first cancer that you had spread and caused badness, but it just means that the sun and genetics that predispose you to that first cancer applies to other areas of your skin, so you're likely to get another one. So if I'm the first person to diagnose a patient with a skin cancer, I say, congratulations, you get to be our friend in dermatology because you just bought yourself skin checks for life. You need to be monitored. Genetics as a risk factor for skin cancer kind of ties into your skin color, hair color, eye color, they all go in together. But I will say, Caucasians are certainly at greater risk for skin cancer than darker skinned people, but nobody is really safe. We've definitely diagnosed skin cancer in African American patients. Melanoma is on the rise in Hispanic patients, and so I like to use my husband as an example because he's Hispanic in heritage, and he thinks that he's off the hook because he never burns, and he says, oh no, that doesn't apply to me. But I like to tell him, no, that's not true. He's just as much at risk as everyone else. Immunosuppressive medicines are also a risk factor, and hopefully not too many of you are on those, but people who have had a kidney transplant, for example, who take medicines to prevent rejection of that kidney, it also decreases your body's ability to fight cancer when it comes up. So that puts you at risk for skin cancers as well. if you're on immunosuppressive medicines, you need a skin check routinely. All right, so what am I talking about? What do these things look like? So this lovely or not so lovely picture is a basal cell cancer. And how we're taught to identify those in the medical training is it's called a pearly papule. And I think that you can appreciate that in this picture, how it kind of shines back at you. It has kind of like a rounded surface, like a little pearl. Often there's a little central ulceration with a little scab there that makes it easy to identify. So if I see a little scab or crust, maybe I'll ask the patient if they've had an injury there of some sort, and if they had no injury there, then the first thing on my radar is I'm thinking that this is a cancer. Squamous cell carcinoma gets tied in with basal cell carcinoma in this category of keratinocyte carcinoma. Don't say it 3 times fast. But basically that name is derived from where the cancer cells start, what layer of the skin that they come from, in contrast to the melanoma type skin cancer. Now, the squamous cell cancer often looks like a red, scaly, either little area of skin or raised bump. And again, they also bleed. Melanomas, I think anybody who looks at this, and if you saw that on yourself or your loved one, would probably say, oh, let's get to a doctor because that just looks abnormal. But what you really need to be looking for, we try to break down in this little mnemonic called the ABCs of melanoma. So A stands for asymmetry. So as you can see in this first line, they show some normal appearing moles and contrast that with melanoma, which are clearly abnormal. Asymmetry, in this normal one, you can draw a line and this lesion looks the same on one side as the other. Whereas here, no matter where I draw the line, whether it's here, or even on a diagonal here, it looks different on one side than the other. So you can see that that's abnormal. B is for border. So this one has a real sharp border. You can tell where it starts and stops. It's real smooth. Whereas here, it's kind of a jagged edge. And I like this example of an irregular border as well because I look at this and I kind of say, well, I don't really know where the lesion even starts and stops. So that's abnormal. Next in the ABCs is color. So this lesion has just one color, whereas abnormal lesions have multiple colors, multiple shades of brown mixed with red. That's a red flag for me. D is for diameter. They use a 1/4 inch in this example. Some people will say 6 millimeters. Other people will say about the size of the head of a pencil. So larger lesions are starting to get a little bit potentially dangerous. To me, this is probably the most important of the risk factors is evolving, something that's changing. So if you have a mole that looks one way for years and years, all of a sudden it's getting wider, it's getting darker, it's bleeding. Those are red flags that you should get that mole checked out sooner rather than later. And so I like to say that dermatologists, we give ourselves job security by telling you all these ABCs and telling you, come see us if you have a lesion with those features. And then maybe you've already done this and you went to your dermatologist and you're like, oh, look, this one's asymmetric with irregular borders and all these colors, and you list off them all. And then the dermatologist looks at it and says, oh, no, that's fine, that's normal. So that's no problem. So I would say that there are benign lesions that have some of these features. So I don't necessarily want you to panic if you have a lesion with these features, but it's a reason that you should go get it checked sooner rather than later. I feel like all I hear all day is every day is the ABCs because I already showed you the picture of my daughter, so I have small kids, so we're doing the ABCs. So I'm excited to also teach them the ABCs of melanoma so that they can be on the lookout as well. Now, I think it's very important for you to check your own skin. So what we know is that about 50% of men detect their own skin cancers on themselves. That brings them to the dermatologist. And then women, we're just better at a lot of things, but 76% of skin cancers, the woman detects for herself, and that's what brings her in to see the doctor. So if you come see me as a patient, I like to be very thorough in my skin exams. I'll look between your toes, I'll pick through your hair, but I really feel like that you and I are a team in identifying cancers because I know that most people find their own skin lesions. So it can be a little bit difficult to do. So you have to get creative using a mirror, maybe using another mirror to look at the hard to see places like on the back side, your back and the back of your legs and that kind of thing. I love this step number 4 is my new favorite ever since a week ago when a gentleman came in with a melanoma on the back of his ear, and I was really impressed and said, how did you even know that that was there? How'd you find that? And he said, well, my hairdresser saw it and sent me to see you. And I said, you need to send that hairdresser, I don't know, some flowers or candy or something. And so I do like to have patients get their hairdresser involved, because your hairdresser is somebody you see on a regular basis. They see you when your hair is wet, so it's easier for them to kind of part the hair and see the scalp itself. A lot of people like to show me bumps on their scalp, which I'm happy to look at, that's no problem, but most melanomas start flat, so it's not something that you always feel. You really need to have somebody looking and seeing it. All right, so I've already told you my bias because I'm a dermatologist, and I think everyone should have a skin exam. I think physician exams are important, help you figure out which lesions are normal, which are abnormal, catch skin cancers early. I will say, to be in all fairness, that the U.S. Preventative Task Service does not recommend nor discourage routine skin cancer screenings. But again, I come from the bias as a dermatologist that everyone has skin. Everyone, especially in Louisiana, has had sun. I think that it's good for at least you to be looking at your own skin and get your doctor involved if you see something that you're worried about. All right, so those are my references, and then those are the reasons I wake up every morning with my beautiful babies. Thank you so much for coming today. I'd be happy to take any questions.